Hi everybody, I'm Dr. Joseph Cipriano, and today we have our patient here. Now, as you were telling me, the main thing going on, so you have neck pain, and that pain comes from the neck and it goes just into the, into the right side there. And it doesn't go, it goes into the arm, but it doesn't go past the elbow, correct?
Yeah, correct.
Okay. How often do you experience that? Is it daily?
That's probably 2-3 times a week.
2-3 times a week?
Yeah.
Okay. And you feel that in here and then, yeah, going down. Okay. And then the other things, you're having some low back pain, and then you're having the ankle pain. So now, like you were telling me before, you roll your ankle quite frequently.
Yeah. Mm-hmm.
All right, so a lot of the times, and what people don't realize is, a lot of times when you have multiple ankle injuries and you roll your ankle a lot, what happens is the hips aren't aligned, but they're not aligned properly. And when you have, if you're walking all day and you've got one leg that's shorter than the other, you're already, you're prone to already putting weight on that outside of your foot.
Mm-hmm.
So what can happen if those hips are all unbalanced, you're always prone to doing one of these and then rolling that ankle.
Yeah, that's
so
what probably happened to me.
Yeah, so what we're going to do, we're going to focus on that low back as well, and we'll also get that foot and ankle adjustment in.
Okay.
So what I want to do first, I want to kind of get a baseline where you're at, because I know you're telling me you're getting some stiffness as well. So if you were to look all the way up at the ceiling for me, any pain or tightness with that?
No.
No? Okay, look all the way down to the floor. Any issues there?
No.
Okay, good. And then bring one here to one side, or to the other side. Any pain with that, or any tightness?
There's a tightness a little bit on the left side.
On the left side, okay. And then if you were to rotate over either side, any issues with that?
No.
Okay, good. Okay, so I'm going to push down on the top of your head here.
Mm-hmm.
Any pain with that?
A little tiny pain on the left
here?
Yeah.
Okay. We're going to turn your head to the side. Any pain with that?
No.
And then we're going to turn your head to that side. Any pain with that?
A little bit here.
A little bit over here? Okay. Back to center. If I'm going to distract up, any increase, decrease of pain, or no pain?
No pain at all.
No pain? Okay, good. Alright, what I'm going to have you do, I want you to stand up for me, and then I want you to bend forward at the waist. Any pain in the low back when you do that?
A little bit on the left side.
On the left side?
On the lower back.
In the lower back.
Yeah.
If you were to lean back like that, any issues there?
Yes.
Yep.
Still on the same spot.
Still in the same spot?
Yeah.
Okay. Point to that spot.
Here.
Okay, so he's pointing on the left side, right around the L4, L5 vertebral range. If you were to come down one side like that, and then to the other side, any pain with either of that?
No.
No?
There's a little stiffness on the left side.
Same
but
spot?
No pain.
Okay. And then if you're to rotate over either side, any issues with that?
No.
No? Okay. So I will have you lay face down for me. Yep. So primarily what he's experiencing, we're getting a lot of positives on that left side. And that was right in here, correct?
Yeah.
Okay, so right in through here is where he's getting a lot of the pain and feeling a lot of that tightness all on the left side. But what we're going to do today, we're going to start off and we scan the entire body. So we're going to scan, from looking from the right side to the left side, looking all the way up from the cervical spine and the head, going all the way down to the feet. So I'm going to palpate, and when I'm palpating, I'm going to be pushing in. Let me know if anything is tender, okay?
Okay.
So when I push in the cervical spine, is anything painful when I push in? Any tenderness?
No.
Okay, good. So we go from that cervical spine into the thoracic spine. Let me know if anything through here is tender to the touch. So we went from that upper back, now into the middle back. Now we're getting into the lumbar spine, into that lower back. Okay. Any pain through here?
A little bit at the left touch on your left.
Okay, so he is still noticing, obviously, that pain on that left side. All right, we're going to drop down onto that right outside joint. If I push in, any pain with that?
No.
Any pain directly over the sacrum?
No.
And any pain on the left side?
No, I don't feel nothing.
Okay. All right, so his pain is a little bit higher up, so more on that L4 region. Now we're going to come down here. We're going to check the leg length out. So when we bring his feet together, as you guys can tell, that right side is pulling short quite a bit.
Yeah, there's a lot of pain there in the left ankle.
Is it? Okay. Okay, and he's even getting some pain in the left ankle as well.
Oh, no, the left ankle is good.
Here?
Yeah, that's what.
Sorry, the right ankle. Okay, so what we're gonna do, we're gonna go through the adjustments and we're gonna get this back lined up. So as you guys can tell, he's been rolling this right ankle a lot, and you can tell that right foot is a lot shorter. So let's go ahead. Now we've already done the massage device. We got things nice and relaxed, so we're gonna go ahead and start the adjustment. So I like to start the adjustment up top at that cervical thoracic junction. Now this is your first time ever getting adjusted, correct?
Yes.
Okay, so first time chiropractic patient, gonna be a first time wide strap patient. So you're gonna hear a lot of popping, clicking. You'll feel a lot of pressure release coming off the nerves, okay? Okay, so we're gonna start with that T1 up here on the left. There we go. And we're gonna drop down to the T2 on the right. Good. Now just with that, you feel how that pressure gets taken off those nerves there?
Yes.
Good. Okay. So I'm going to have you take a deep breath in and exhale all the way out. Good. And we're going to drop down a little bit. Deep breath in and exhale out. Perfect. So we're going to come back down here. Let's check the leg length out. So it's gotten a little bit better, which is a good thing, but still need to do some work. So what I'm going to do, I'm going to stabilize right here on the sacrum. I want you to raise this right leg up as high as you can for me. No, I want you to do, here I'll show you, relax, relax. I want you to raise your leg like that.
Oh, like that.
Yep. So I'm going to do that, raise it up. Any pain, tenderness with that?
No.
Okay, relax that side. Raise this side up for me. How does that side feel compared to the right?
Just a little slight pain on the left side, but not much.
Oh.
I barely felt it.
Okay, so not much, but it's a little bit harder to raise this one?
Yeah.
Okay, so what I want you to do, I want you to cross this left foot over that foot for me. Yep. So the table's gonna come up, we're gonna be doing a drop technique. And with this, we're gonna bring that sacrum here, we're gonna get that more towards midline. So we're gonna do a P to A drop, posterior to anterior, and this time we're going to be doing a clockwise torque. There we go. Raise that left leg up now. How does that feel?
Better.
Is it easier to raise?
Yeah, a lot more.
A lot more. That's what I like to hear. Good. So now when we come in and we take a look at that leg length, completely balanced. That right side was pulling so much shorter originally. Now when you look at it, it's balanced. The heels are matching up. So that's exactly what he needed. That left side was actually way out of alignment there, which is a good thing. So what I do want to see here, is there pain still in here?
No.
No? So originally, when I was pushing in right in through here, he was experiencing pain, but just with doing those adjustments, he's not feeling that anymore. So I'm going to have you give yourself a big hug here, good? And with this, I'm going to have you take a deep breath in and exhale out. Good. And relax right there. So now what we're going to do, we're going to do that wide strap adjustment. You can relax your arms. So this is that powerful decompression technique. You'll feel this all the way up from that cervical spine going all the way down as well. Okay, so this is one of the main reasons why people come in. They really want to get this decompression technique done.
Jesus.
Relax, relax. And you feel how that just opened up. Alright, come on up. Alright, how would you describe that to somebody who's never had that done?
Well, it's kind of hurt a little bit, but it feels good.
Hurt a little bit, but feels good. Look up, look down. Again, like look around. Do you notice the difference with moving your head and neck around?
Yeah.
A little bit easier?
Mm-hmm.
Good.
Yeah.
Good. Yeah, that thing is powerful. That gets a lot of movement. You'll feel that going just all the way down the body there.
Mm-hmm.
Okay. Alright, so I did want to check that right ankle out, so I want you to slide back. Lay on your back for me. No, on your back, on your back.
On my back?
Yep. No, you're good, you're good. And then scoot up just a little bit. Okay. So that you're even having those issues with the right ankle. Granted, we got the hips realigned, we got the leg length back to alignment. What I want to do, we're just going to get some relief in the actual ankle itself because it's been out of alignment for such a long time from the hips that he's been putting abnormal pressure on his feet. So we're going to start off here. Good. Yeah, we're just doing a little bit of a shearing move. It's just trying to break up any of the scar tissue in the area here. There we go. Good, and then we'll get the other side too. And I know you're feeling how that's...
Yeah. Felt a lot.
Yeah, even felt that into the knee with that one there.
Cause I don't know, on my knee, the left knee, the one you're working on right now, it kind of locks every time.
Does it?
Yeah.
Alright, let me do, so I'm going to do a leg pull on this side. Relax, relax, relax. And you felt that even going to the hip too?
Mm-hmm.
There we go. Come on up. There you feel how that, even just with those adjustments down in the feet and the legs, you feel how that pressure got taken off. So now a little bit I know with you, just because that you have been having that rolling sensation of the ankle, now that the hips are realigned, you may notice a little bit difference with walking again, in a good way though.
Okay.
But yeah, so now that we have the hips balanced, you're gonna be putting pressure on your feet properly now.
Okay.
So that's gonna be a good thing. That'll help not roll the ankle anymore. Perfect. But how are you feeling from when you first came in to now? You notice
a lot better.
Perfect. So if anyone is looking to get an adjustment, I would love to get you scheduled in here. Just go right to the website, drjosephcipriano.com. From there, send me a message. I typically respond back within 1 to 2 days, but I'd love to get you in here and help you out. Have a good one, everybody.